how might PD affect one's sex life? And I know that there's got to be differences between, someone in their early stages, a young onset, and then those over 50.
So on the physical side, what I typically see is obviously mobility issues, the tremor, the rigidity, some of those things, even that facial masking that can create and impact sexuality. But then on the emotional side, there's all the issues around depression or fatigue or body image, or just feeling your partner feeling like they're in a role of care partner rather than just equals. And so there's a lot of things that affect sexuality that come into play on an emotional level, on a body level, on a physical level. What people with Parkinson's have to remember is they have to see sexuality and their sexual experience in very broad terms. They can't just see it as how it used to be when they were younger, or how it's just about their functioning, their sexual functioning. They have to be able to see it as sort of this buffet of different pleasurable things they could do with their partner that are connecting, and what's available to them that particular day, and what do they feel like they want to engage in. It can't be just a particular small definition of what sex is. That's what I find is most useful to Parkinson's patients, is just really expanding their view on sexuality. Yeah.
So intimacy and creativity are key.
Absolutely. Absolutely.
How does sex differ for a person with Parkinson's that is male versus female?
Women often experience, especially if they're older, or they've passed menopause, they're experiencing more pain potentially, or more dryness. Men are often struggling more with erections or finding their orgasm. Women can also struggle with finding their orgasm as well. These are actually some normal things that often happen just with natural aging. So you don't know whether it's really related to Parkinson's or aging. For younger folks, I think they just are struggling with some of the mobility issues that I was talking about earlier, and just feeling like they're a young person, but their body isn't responding or reacting in the same way. And so that affects their self-esteem and their body image. And so it's a more emotionally impacting experience having Parkinson's.
What are some things that I can do, a person with Parkinson's can do in order to combat some of these obstacles?
I think one of the things that's really valuable is seeing ourselves as not just about our sexual functioning. I think it's seeing ourselves as more complete humans, and realizing that our interest and our warmth and our engagement is also what makes us beautiful lovers. That's one of the things that I think can be really helpful. Another thing is communication. Normally, when everything's working fine, we don't often have to talk about sexuality. We just kind of move into it easily. But when we have health challenges or aging, we need to begin to maybe talk more explicitly. And many of us are not used to doing that. And so it's a skill we need to develop so that we can really communicate with our partner what works for us and what doesn't.
What kind of tools would you suggest and recommend to people with Parkinson's who, maybe need help with the communication or intimacy factor?
So one of the concepts that I really like and talk with my clients about are the 5 love languages. And there's a book about it, and there's an app to go with it. And I think that can be really helpful to learn the way in which your partner likes to be loved. That book or using the app can be super helpful. Take a little quiz and you learn what your primary love language is. And that's what you want your partner to do for you. Another couple of books that I really like that I think helps people expand their idea of sexuality. One is called Sexual Intelligence by Marty Klein. It's not a book specifically for Parkinson's patients, but it's a good book for helping people think outside the box rather than just a narrow definition of how they see sex.
Sexual problems are fairly common amongst those with Parkinson's. However, there are things you can do to help. Improving communications with your partner can be really beneficial. It's important to remember that sexuality is not just the physical act of sex, it's also everything else that goes along with it. If you're interested in finding out more about Parkinson's, subscribe for a new video every Thursday.